Hey YouTube people, so a lot to talk about, let me tell you that. I sound kind of funny because, well, I've been through quite a bit. You may be wondering why I haven't posted a video quite yet. I was again in the hospital, and I'm looking on my phone for something, so I keep looking down, but there's really no other way to explain to you what happened to me in less than 10 minutes other than to read to you my blog that I wrote about the situation and why I was in the hospital. Sorry, cat. It's Zoe, for all of those of you who've missed her. Okay, can you get down or I'm going to squirt you, babe? It's the magic squirt bottle. Works every time. So, here goes. So bear with me, okay? Alright. Let's go with my iPhone here. Fancy dancy. Okay. So, pardon my reading. Hopefully you can hear me okay. I titled it, "How Did I Even Survive This?" Sunday morning during church service, I started experiencing this horrid pain in my back on the right side only. I leaned toward my mom and told her. She said to go to the restroom. Maybe I needed to stand up because I pulled a muscle or something. It didn't help at all. In fact, it only made it worse. By the time church was halfway over, I was hunched over in the chair about to cry. I told my mom I needed to leave, and that's when I told my fiance that we needed to go because he drove me. I drove him with my parents. My mom, made me call the surgeon on a call, which was Dr. Swartz. He said it could be my gallbladder and I should go to the ER. By now I was doubled over in pain that was constant and I was crying all the way to the hospital. ER was empty in the waiting room, so I called back quickly. Unfortunately, I have small veins. Not sure if you can see that, but that's one of the major things that they did. And, so after 10 tries to find a vein for my IV and a bunch of sorries, I was in the ER for 3 hours in excruciating pain, so bad I was dry heaving every few seconds, not to mention moaning, crying, and could not sit still with no pain medications. Finally, they found a vein that I had pointed out to them and gave me some medication which was called Dilaudid, which was my miracle drug. Instant pain relief. Believe me, though, that when it wore off, I was begging for more. I was laying in the ER for 9 hours until they finally moved me to a room at around 9 p.m. I spent the night there. The pain subsided around 12 a.m. At 7 a.m., Dr. Swartz came to see me and to find out more about my symptoms. I explained to him that it started with a warm burst throughout my stomach and then went away. Then I had a terrible back pain on the middle of just the right side of my back. The doctor in the ER said they tested my blood and my liver count should have been 10 to be normal. Mine was at 230. No gallstones, though, said the lady who did my ultrasound. No kidney stones either, which actually run in my family. Dr. Swartz said he isn't for sure what's going on, but is about 90% sure it is my gallbladder because of the symptoms and all. He would do surgery that day, Monday, this last Monday. The date was the 18th. Man, I tell you, the 18th is not a good day for me. That's the day that I went in for my original surgery, was the 18th of November, and now 2 months exactly later. What are you doing? Get down. Oh my gosh. My cat was under this desk here. Anyways, so Monday at 4:30 p.m. and he would check my gallbladder, remove it if it's not functioning properly, check all of my intestines for a hernia, and do yet a 4th endoscopy, all while I am under, since I am having problems keeping solids down. Hold on. Turns out my gallbladder had stopped functioning, causing me extreme pain. He removed my gallbladder. I had no hernia, but I did have an ulcer, so he prescribed me Nexium for that. Well, my insurance doesn't cover Nexium, so it's only generic brand, so it's actually omeprazole. Omeprazole. I don't know how to say it really, but works the same way apparently. I was sent home Tuesday morning at around 10 a.m. with Vicodin, which, by the way, does not work. It only makes me tired but doesn't get rid of my pain. Anyways,